One of my children has a serious health problem. A few years ago, she had a 3-week stay in the ICU and a series of 3 brain surgeries. The medical care was exceptional. One of the physicians stood out. In addition to the medical expertise, he always spent a little extra time with our daughter, admired the artwork from her classmates that wallpapered the room, provided support to our family, and walked with us on a frightening journey. As a physician, I can say that he embodied the best and most noble ideals of our profession. 1 month ago, this physician, who was under age 45, almost left the profession due to burnout. Instead, they decided to cut back to half-time for 1 year before making a final decision. Unfortunately, I know of many colleagues with similar stories. Today's medical practice environment is destroying the altruism and commitment of our physicians. In our 2011 study, 45% of U.S. physicians had at least one symptom of professional burnout. That figure had risen to 54% by the time of our 2014 follow-up study. The problem affects physicians of all specialties, but is particularly acute in the primary care disciplines. Extensive evidence suggests that burnout affects quality of care. Studies have linked burnout to medical errors, mortality ratios in hospitalized patients, and lower patient satisfaction. Burnout also impacts access to care. The Department of Health and Human Services projects that the U.S. already faces a shortage of 50,000 physicians by 2020. Recent studies suggest that burnout increases the likelihood physicians will reduce professional work hours, work part-time, or leave the profession. Other physicians are leaving primary care to start concierge practices to escape a broken medical system. This suggests that the increasing rates of professional burnout will reduce the adequacy of the physician workforce precisely at a time we are already facing shortages, particularly in primary care. The rising tide of burnout, coupled with its effects on quality of care and access, make burnout a major threat to the nation's healthcare delivery system. Unfortunately, only Band-Aids have been applied to address this problem to date. These efforts have primarily been comprised of stress management or resiliency workshops or teaching mindfulness to individual physicians, typically training offered on nights and weekends. We tell physicians to get more sleep, eat more granola, do yoga, and take better care of yourself. These efforts are well-intentioned. The message to physicians, however, is that you are the problem and you need to toughen up. Or, using the more in vogue parlance of the day, you need to learn to be more resilient. What if we stopped blaming individuals and addressed the real causes of this problem? If I told you we had a widespread system issue that limited access to care, threatened our ability to provide high-quality medical care, and eroded patient satisfaction, you would assign your best team of system engineers to address this problem immediately. Physician burnout is precisely such a system issue. If it affects half our physicians, it is indirectly affecting half our patients. The 6 drivers of burnout among physicians are largely derived from characteristics in the practice environment: excessive workload, inefficiency and undue clerical burden, loss of flexibility and control over work, problems with work-life integration, loss of meaning in work, and organizational objectives that conflict with the altruistic values of the profession. Each of these drivers has individual and organizational dimensions. Given this fact, addressing burnout and promoting professional well-being is the shared responsibility of both individual physicians and healthcare organizations. So how do we move toward a better framework? First, we need to start trusting physicians again. This would mean eliminating intrusive regulations that do not add value to patients' medical care. Federal regulations that lead to physicians spending more time documenting extraneous details to substantiate a billing code than they do actually taking care of the patient must be re-examined. We need to devise more accurate approaches to assessing quality than spending time recording and measuring things that are easy to count, but that ignore nuance, context, and individual patient characteristics. The insurance pre-approval process for tests and treatments must be improved. Documentation requirements that drive medical centers and physicians to spend tremendous energy and effort to make numbers look good rather than concentrating on actually providing good care should be eliminated. Second, physicians need to focus on doing the work that only physicians can do. This would require that physicians work at the top of their licensure and that hospitals and healthcare organizations allow that many tasks being performed by physicians today be delegated to support staff. It would also require organizations reevaluate short-sighted cost savings realized by eliminating support for order entry and transcription, but which have turned physicians into typists and clerks. It would require EHR vendors create more user-friendly technology, and that greater thought be given to how electronic health records are utilized so that they facilitate patient care rather than distracting physicians from interacting with patients and creating clerical burden. We need to get back to doctors being doctors. Third, we need to set workload expectations based on what it takes to provide good patient care, rather than to reach the number of RVUs the organization desires to meet a financial productivity target. This latter focus has resulted in rushed office visits, fragmented care, and a production line mentality that is incongruent with the altruistic values of the profession. The current reality of physicians working 14-hour days at the clinic or hospital and then going home to spend 2 to 3 hours charting in the EHR is not sustainable. We have the metrics and tools to determine the time necessary to provide good care. Time studies coupled with measures of patient satisfaction, peer review of quality, and measures of patient outcome can define the amount of time it takes to provide high-quality care. Redesigning workload in this way, however, would require government and insurance payers have the courage to rethink the structure of care and reimbursement. Fourth, every medical center should measure, track, and benchmark the well-being of their physicians as a strategic imperative necessary to provide high-quality medical care. Systematically measuring well-being provides us the opportunity to optimize resource allocation and monitor the impact of well-being on other critical organizational objectives, such as safety and quality. It would also stimulate efforts to develop, implement, and assess the effectiveness of organizational strategies to promote engagement and well-being. Finally, realizing these changes requires effective leaders working in partnership with physicians. Although historically most physicians worked in solo or group practice, a majority of physicians today work in an employed practice model. We have shown that the leadership behaviors of physician supervisors have a strong impact on physician burnout. Participatory management, characterized by leaders who inform, engage, develop, empower, and recognize the achievements of their physicians, reduces physician burnout at the work unit level. Physicians and leaders working together constructively to identify, develop, and implement solutions for problems in the practice environment also demonstrates to physicians that improvement is possible. This approach transforms physicians from victims in a broken system to partners working with leaders to create their own future. American medicine is at a crossroads. We need to stop blaming individuals and treat physician burnout as a system issue. Leaders working in partnership with physicians to develop bottom-up solutions will be critical to progress. We must re-engineer our practice environment so that it facilitates high-quality care and supports rather than injures healthcare providers as they take care of patients. Thank you.